Hello everybody, thank you for joining me. I'm going to show you a couple of things you can do to help either yourself or your clients get a little more in touch with their foot. The first thing I'm going to have you do, or have you think about doing, is roll out the bottom of your feet. I learned this method, this suggestion originally from Dr. Emily Slickle, and the reason I think it's really good is there's a lot of mechanoreceptors on the bottom of your feet that, because our feet are often shod and aren't actually interacting with the environment, we sort of lose contact with. So the simple act of rolling out the bottom of the feet increases blood flow, it increases a little bit of awareness, and I think it's a really valuable tool. So I'm going to use a little pet ball. You can use a golf ball as well. You place the ball under the foot and you put pressure on it just like you would any other body part. And you see if there's any tender points. So that is, like I said, just a valuable thing. And I like to do it at night while I'm brushing my teeth. Again, just increases blood flow to the area and gives me a little more awareness to the area. And then give the ball to the pet. From here, you can look at how you use your foot strategy when you're in contact with the ground, just when you're standing. And obviously, when we move, our foot has to go through multiple planes of motion. It pronates, it supinates, it pronates. So it's not, or it supinates, it pronates, it supinates. So your foot, it needs to have a bit of flexibility, and it's meant to move through a variety of different planes. So in static, what you're going to look for is you're just going to see if your feet collapse inward, if you roll to the outside of your feet, or if your feet stay pretty neutral. And you'll notice what your arch does, if your arch falls, if your arch is lifted. And this isn't necessarily the world's end-all, be-all for how a person moves in terms of their movement strategy. Again, this is looking at something that's static, but I do think it's valuable in getting a little more integration with the hip. If you can start to figure out what a more neutral calcaneus or more neutral foot position is. So what I usually do when I'm working with someone and I'm doing a little bit of barefoot work, and I usually only do 5 to 10 minutes of barefoot work a session, and not with all of my clients, just with the ones that I'm really trying to optimize their hip strategy. Spread the toes, and that right there is going to be challenging for a lot of people. Once the person does that, I have them just notice where their weight is. If their weight is really far forward, if their weight is really far back. I find that a lot of my clients, especially ones that are prone to a little bit of an extension pattern, their weight's pretty far back into their heels. So I'll have them rock forward and back a few times, and then find the center point. And I let the person find the center point. I think this is valuable because it starts to ingrain it a little bit more, and it makes it easier for the person to find it when they're setting up for their golf swing or when they're getting ready to perform other movements on their own. Then I have them notice if a lot of their weight's on the right leg, a lot of their weight's on their left leg. I have them just rock a little bit from side to side and try to find a centered position on both feet so that 50% of the weight's on the left leg, 50% of the weight's on the right leg. From there, I have them notice if the arch is lifted or not. So what a lot of my clients find is I see both. I see people that have all of their weight on their pinky toes and have no weight on the big toe at all. And then I also see people with completely flattened arches with no weight on their pinky side. So I try to encourage them to find a center point, find the middle of the foot. And that should naturally start to lift their arch a little bit. If they're having, and I ask them to notice what happens with their hips when they do that, if they feel any difference in how their hips feel when they find the center of the foot. One of the easiest ways to work with people on getting a little bit better foot strategy is in a kneeling position. So I have them take one knee back, the other foot forward, and from here, spread the toes. Again, you want to get a nice, just like when you're on your hands, you want to get a nice wide base. And then I ask them to maybe press the big toe into the ground a few times. I might lift the big toe, press down. Again, just get a little activation through there. And then I ask them to find a centered position with the ankle. So that means the arch is going to lift a little bit. There's still going to be connectivity with the toe. And the weight is going to be centered in the middle of the foot. The heel is going to be neutral. So I would actually look at that. It's hard to see, I know, from this angle. But you would see, turn around, you're not here, you're not here. The ankle would be neutral in the calcaneus. Once the person gets that sensation, again, I have them notice what's happening with their hip when they're there. And the back foot can either be dorsiflexed or plantar flexed, it doesn't matter. I have them try and level out their hips and then get square in their hips. Often, just that cue right there gets integration with the foot and the glute. Often the person will say, oh, I feel my glute now. From there, what I do, if the person's ready for the next step, is I have them pretend like they're gonna lift their back knee off the floor. So they really press into the floor with their left foot, pretend like they're gonna lift that back knee, and then relax. So it's a pretend lift, and then relax. And what that does is it just reinforces that the foot and the glute work together. If you have someone whose pelvis is oriented more with the left hip forward and the right hip back, that's their normal strategy, then putting the right foot forward is going to be a little more challenging for a number of reasons. But they'll feel a little more stretched through here. They might have a little harder time interacting with the foot. But you do exactly the same thing. Spread the toes, then engage the big toe. You can use a couple of different strategies for that. You can lift it, you can move it. Just get the sense that that big toe has a little activation and is pressing into the floor. And then get the sense that the arch is lifting without activating this tibialis anterior. I did not talk about that on the other side, but you don't want to see that. You want that to be relaxed. Once that's there, get even through the hips. Again, press through the foot. Pretend like you're going to lift the back knee off the floor just a little bit and relax. And again, just notice the activation when you press the foot into the floor with the glute. All right, I hope you found that helpful, and thank you.